class, I was telling to one second. Yeah. So last online class, I was telling, see, this online classes, it's very difficult to communicate to the other part because it's like you are looking at you, speaking to you, telling you what are you. It's all you. You can't see anyone on the opposite side, and it's very difficult for us to convey our matter or put across our things. So anyway, I agreed to Dr. Sanoff that, okay, I'll just take one more online session. So I welcome all participants to this pediatric session. I'll just share my screen. Yeah. All right. Good evening, all. So what's all about, what is this pediatric dentistry is all about? Can someone share your knowledge or your thoughts onto it? Anyone? I think all are mute and fine. That's okay. I'll just speak myself. Okay, that's now we say pediatric dentistry and teeth, the oral cavity, all they say that's anyway, it is the teeth which is going to shed off in a matter of time. And why, doctor, why do you want to save this pulpectomy, or why do you want to save the tooth, or why do you want to make tooth into the functional form? But see, what are the functions of an oral cavity? So the oral cavity, this can be the functions can be divided into the injection of food, the secretion of saliva. There can be chemical and mechanical digestion of food. Then the half digested food can be propelled into the digestive system, other part of the digestive system, where the chemical digestion starts taking place. So when the food is ingested into the oral cavity, see, first there will be secretion of different types of salivary enzymes, like salivary amylase will be there, salivary lipase will be there, then salivary kallikrein will be there, because these enzymes are actually required for the chemical and the mechanical digestion of food to start. Okay, so it is like you need proper saliva secretion to be there. If there is, when the food comes into the mouth, there should be proper secretion of saliva, and it has to mix properly. Then see, if there is painful teeth, if there is a cavitated tooth which is not in its proper function, then there will not be any mechanical digestion of food will happen, because we don't have any teeth inside your stomach or small intestine or large intestine, wherever. So there will not be any mechanical digestion will take place. As well as this, because of this oral enzymes which is been secreted, there will be chemical reaction also which happens inside the oral cavity. Then this mixed food has to be the mixed food has to, I'm so sorry. So the mixed food has to propel in, it has to be made into bolus, and it has to go into the other part of the intestine, so that the other chemical digestion starts taking place. So many things, that is, injection of food should be there, the secretion of food should be there, chemical and mechanical digestion of food should be there. So these are the primary function of the oral cavity. So then again, yeah. Then you see, when the oral cavity has, if at all the oral cavity has got so many caries, so what happens is, like, see, the caries is not only due to the food which we eat, but there at the same time there should be microorganisms also. So this microorganism which causes the respiratory tract infections, the tooth decay, all will be there inside the tooth. So if the tooth has got many decay or anything, that means your microorganism which causes the dental caries and the upper respiratory tract infections are more. So these children who has got too much of dental caries will definitely will have upper respiratory tract infection, which will be very common to them. Then when the upper respiratory tract infection is there, chronic infection is there, the child automatically starts to go for a nasal, instead of nasal breathing, they go for an oral breathing. So that is mouth breathing they starts developing. So if there is too many caries, that can cause upper respiratory tract infections, which again can cause the child to develop a mouth breathing habit. So when there's a mouth breathing habit, again, there will be gingival infection will be there. There will be drying of the mouth. And then the secondary problem is there will be proclination of teeth. So a dental caries can cause upper respiratory tract infections, as well as it can develop other habits like mouth breathing. Same time, there will be proclination of the teeth, or the maxillary growth will be more. Again, that's all due to the dental caries. Then you know that the teeth or the cavity, mouth, the teeth has got too much dental caries, or the oral cavity which is infected, that can also affect your general health of the body, especially the cardiac tissues. So the cardiac, there will be infection of the cardiac septums, and other cardiac issues will be there. Cardiac valve infection will be there. Then in case of children, you think that we all think that children are just the miniature of adult. So it's like you give 500 mg of mox for a child. Immediately what you do is, if a child patient comes, you think, okay, I can either give 250 or 125. No, it's not that case, because the children, you know, when they give birth, when a child is born, they have more of extracellular fluid inside their body. So when you start in the early period, if at all you want to go for any antibiotic or anything for a child patient, see, it's all water soluble antibiotics or analgesics you need to give. So that is water soluble medications you need to prescribe for the child. So this same child, when it becomes, say, maybe like 1 year or 2 years, they are more chubby. So more of fat tissues being deposited. So they need the fat soluble medications. Same child, when it comes to maybe like the age of 4 years, 5 years, that is very naughty age, they will be just starting running around. So more the fat comes down and more of protein comes down. So each age of the child, and again, see the kidney and liver, it is not developed that much in case of a pediatric patient. So when you give medications, you should consider which are more the medicines which are more friendly to their kidney, and which can easily be excreted, easily metabolized by the liver and easily excreted through the kidney. These are the medications you should consider when you think about a pediatric patient. So the medications, you should be very careful. So again, I can tell you the growth and development, because if you don't eat properly, the chemical or mechanical digestion doesn't take place in the oral cavity. What happens? The proper growth and development doesn't take place, because see, the digestion doesn't take place or starts inside your stomach. It starts inside your oral cavity. So if the child needs a proper growth and development, yes, definitely they need a function-full oral cavity, or disease-free oral cavity, infection-free oral cavity should be there for proper growth and development of the child. So in this diagram, you can see there is, see, when you see this diagram, we all have learned the Scammann's growth curve. So that is like from 0 to 10 years of age, your maximum growth takes place. So it is during the primary dentition time, you require more nutritious food for the child. If the child cannot eat properly, then the proper development of lymphoid tissues, brain, musculoskeletal growth, then your other hormonal growth doesn't take place. Only the growth you can see in this graph, that only your reproductive system grows after the age of your permanent dentition have started. So if at all your child or your child patient has to have a good growth and development, good health, make sure as dentist, I don't call ourselves as dentist, but our oral physicians. So we have to function as an oral physician. We should take care of the overall growth and development of the child. We should take care of the medications what we prescribe for the child, and so on. See, in this, again, you can see at the age of 0 to 5 years. Sorry, 1 second. See, this 0 to 5 years of age, your brain development grows, then it grows more than any other part. See, it's 4% growth. Say, when you consider the growth into 1 is static growth, 2 mild growth, 3 it's moderate, and 4 is significant growth. See, significant growth of the brain takes place from 0 to 5 years, where you have all your primary teeth. See, and then your next is like your gastrointestinal tract. The maximum growth takes place out there. Urinary system, maximum growth. Lung capacity increases more in child than lymphoid tissue. That you have seen in Scammond's growth curve. The maximum growth of the lymphoid tissue takes place there. Liver again. Then your head and neck growth region. So see, the growth happens from 0 to 5 years is maximum in this brain. You have in gastrointestinal system, urinary system, all that. See, then from 5 to 10 years, see, hardly you have on the lymphoid tissue. When 10 to 15 years, you have only the gonadal growth will be there, and your skin growth will be there. Then musculoskeletal growth, that is again during the mixed dentition period. So during the mixed dentition period is the period where the maximum growth takes place for your child or your child patient. So we should be very careful onto the overall oral cavity. See, the oral cavity growth. In general, the condition of the oral cavity, you should be very careful. Then, see, we all have learned pedodontics is an age-defined specialty. What do you mean by age-defined specialty? It's like, see, in all other departments, like when you see in a conservative department, you will be just focusing on dental caries. So any dental caries which comes, see, you just need to remove the dental caries properly and do a proper cavity preparation, do a restoration. That's it. See, if the patient comes at 10 years, if the patient comes at the age of 20 years, 50 years, or even at the age of 100 years, if you see a dental caries, it's just a matter of caries removal and then filling. But in case of pediatric dentistry, if the child comes maybe at the age of same caries, maybe like a class 1 mild enamel caries, at the age of 3 years, definitely you require restoration. Same at the age of 6 years or 7 years, till the age of 7 years, you require restoration. But that same patient with a small enamel caries, class 1 enamel caries, comes at the age of 12 years. You don't require any restorations unless and until it is creating any pain. If it's creating pain, you need to go for an extraction. So for a dental caries, at the age of 3 years, you need a restoration. But same patient who comes at the age of 12 years or 10 years, 12 years or 13 years, you are going for an extraction. So for a dental caries, same dental caries, you have different sort of treatment plan at different ages. Then I said about the medications you give. So medications at the age of less than 1 year, you have water soluble medications. Between 1 to 3 years, you have fat soluble medications. After that, see, you need to see upon the weight of the body, then the liver development, liver and kidney development, how much liver and kidney development has taken place. So depending upon that, according to different ages, your prescription of medication differs. So say a case of a patient who comes with periodontal disease, you might have to go for a flap surgery or anything, because it's it is concerned with gingival diseases. When it comes to an ortho, it mainly comes with what do you say, a malfunction, malaligned teeth, or you have your myofunctional appliances. So you, for every other specialty, you are dealing with disease. But in case of pediatric dentistry, rather than disease, it is by the age. You look into the age of the patient, and then you see whether at that particular age that treatment is required, or what other options of treatment are required. So that is why periodontics is called an age-defined specialty. And See, I talked about so much of the need of a good oral cavity. Now look into this picture. A patient who has got, see, so many caries. Anterior teeth is completely gone. You have root stumps, infected root stumps. You have infected posterior root stumps, a non-functional, painful primary first molar. Here, if you see caries, affected teeth, and so on. So same patient on the lower aspect. So do you think this patient is able to chew anything or eat anything? Because this patient had multiple times there was infection of the oral cavity. There multiple times infection of the oral cavity was there. Child was not able to eat anything. So finally, the parent, I think this child was almost like 3-year-old child. 3-year-old child, the parent was telling like, doctor, she's not eating anything and she's having recurrent infection inside the oral cavity. What can be done? So many people who have the parents have taken the child to many of the dentists, and the many of the dentists said like, this we can't do anything because the child is only 3 years of age, and you can just give medications. But how long? Because this child was taking medications from the age of 2 years now till now the patient's age is at the age of 4 years. So how can they take so much of antibiotic and analgesics for the same child? So it's like I had done the treatment under general anesthesia, this patient, and after 2 weeks or so, the mother was just crying at me and saying, doctor, I was thinking that my child doesn't want anything else other than milk and biscuit, because she was eating only milk and biscuit. So even when they were trying to give other sort of things like rice or chapatis, fruits or whatever it is, she was not ready to take it. So they were thinking like the child doesn't like it, and they were giving only milk and the biscuits. But after the full complete oral rehabilitation has been done for this patient, the mother was literally crying and telling me that, doctor, I didn't know that my child wanted to eat so many things, but because she was not able to eat, because she has pain and this difficulty in eating because the teeth were not in the functional form, and so many other things, because see, you can see the mouth itself, because she will not be able to, he or she will not be eat anything with this. And after the full rehabilitation has been done, child was eating so many things. So it's like, she, as if she has not seen anything. I had seen the food like starving. So that is what we can do as dentist or as pediatric dentist. Your focus should be on the overall health of the child by giving a painless mouth or painless teeth. It's not only painless teeth, but at the same time, you should make sure it is in the functional form. Yeah. So that's about the pediatric dentistry definition. But we say a dental care which medically necessary for the purpose of preventing and eliminating orofacial diseases. See, so many infections will be there. It's like you are either preventing or eliminating orofacial diseases. Infections will be there, abscess will be there, pain will be there. And later you will be restoring the function. So as a pediodontist, as a dentist, you should be able to restore the form and function of the dentition, so as the child will be able to eat things properly. There will be proper digestion of the food, which can help the child disease free. And at the same time, the growth and development of the child takes place normally. So as a periodontist or as a dentist, your responsibility will be just removing the overall disease or orofacial disease of the child, pain. It's not only removing pain, but at the same time, you need to restore the function of the teeth. Okay, so I have spoken so much about the functions of the oral cavity, the importance of teeth, preventing orofacial infections, at the same time preventing upper respiratory tract infections. But many of your questions will be like, doctor, how? How can I? The main problem which we face or with the child faces is the fear of dentist. Either they would have gone to some a dentist, and because he or she not able to manage the child properly, and sometimes the child had severe pain will be there during the treatment, which makes the child fear of dentist. Because when I'll tell you later about what are the things, which small mistakes which we make when as soon as we see a child patient. Okay, so how again, I don't think so. Many of my friends usually say that, doctor, I think our dentistry is saturated. But I will say, definitely say, dentistry is not saturated, because see, the studies have shown that almost 21% of the population, they don't go to a dentist because of the fear they have got during their childhood, and which is still carrying with them. So because of that, they definitely don't go to a dentist for dental treatment. Okay. Then the next is like, see, the era have changed. The change in parenting have come, because previously, like scolding a child to get a better behavior or for a good behavior to develop, to scold a child was common in the society. So if your elder ones in the family sees that the child is doing something naughty, they could scold it, or teachers at school, they used to scold it, or sometimes a neighbor, definitely they used to scold the child if they find the child doing something naughty. But nowadays, you yourself know that if at all the parents scold the child, definitely the grandparents will be there saying that you should not scold him, or because this is a small child, he can't understand. Okay, so it's a small family where now scolding child doesn't takes place. So the teachers in school, they cannot scold when, if they, even if they find any gross guilty with the children, still they will not be able to, they are not able to, they should not scold the child. So if that is a scenario, do you think that us dentists, we can do, we can scold the children? It's like, say, sometimes we say it's a voice control and just shouting at the child. Sometimes we'll be doing hand over mouth exercise, because during our school time, dental school time, see, hand over mouth exercise or physical restraints during the dental treatment was more common. But nowadays, it's all been removed from the dental curriculum, because you are not supposed to scold the child. You cannot use hand over mouth exercise. You cannot use any of the physical restraints. So this all, so many rules and regulations have come. Excuse me. So even the parents, if parents, they expect when they take the child to a dentist, they expect a playful condition, a pain-free condition, and they expect the child, the doctor should treat the child in a painless manner, very painless manner, and my child should always smile at me. So that's what even most of the parents demand for it. Okay, and see, this is what, see, in my time, the dental schools were like, see, you can see so many hands. It's like 10-handed dentistry. Other departments of dentistry, like conservative dentistry or your perio, your ortho, all they have 2-handed or 4-handed, or now they have started with 6-handed dentistry. But in pedo, it is like already we have started with 10-handed. So this era it's all gone. Even, see, we have seen so much of time the dentist wrapping the children in bed sheet, or their physical restraints have been done. But these all things like hand over mouth exercise, everything is banned nowadays. We are not supposed to do or treat any children with all these physical restraints, especially hand over mouth exercise. So it's all punishable act nowadays. Okay. So, and at the same time, I'll say the pediatric dentistry is challenging, because there are so many rules and regulations have come. Like POSCO Act is there, Child Abuse Act is there. So it's like, see, you hold the child and do any treatment, it comes under child abuse. So, and if at all they want, they can go for a POSCO Act case against. Because recently, one of the dentists who have done an extraction for a pediatric patient, it's like the mother told doctor, I don't know whatever you do, but make sure that there's a treatment done for my child today itself. So the dentist have told them, if you hold my child, if you hold your child properly, I can do the treatment. So the mother agreed to it, and they have done the treatment. But what has happened is, like, when they have gone back to their home, the father has seen some marks on the cheek of the child, and so the father asked the child what happened. Immediately, the child replied is like, the doctor slapped me during the treatment. So you imagine the behavior of the children nowadays. It's like they're convinced the parents in such a way that, sorry, the father in such a way that the doctor almost hit her on her cheek. So the father asked the mother exactly what has happened. She said, she was holding the child in dental chair, and the doctor has just done the extraction properly. But the father was not convinced by the reply what the mother had given, but he was much happy, or he was convinced with the answer what the child had given. So he had taken the child to the police station and booked a case against the doctor under POSCO Act. And finally, the doctor had shown the police people the video recording of what has happened. Luckily, he had a camera inside the dental clinic. So even though he had shown the evidence, since it was booked, the case was booked under POSCO Act, it was not easy for even for the parents to withdraw the case against the doctor they have given. So that's what, so many rules and regulations are there. Imagine a shouting at the child in the name of voice control. We are not supposed to shout at the child in the name of voice control. So that's what, so many rules and regulations are there. So the pediatric dentistry trends have been changed a lot nowadays. Now you require something like a pleasing environment. So it's when now you have seen most of the dental clinic, they have a special room for the pediatric dentistry, even though they have they are not specialized in pediatric dentistry. Might be they have a pediodontist coming to their clinic for consultation. So they have a separate specialty clinic for pedodontists, for pediatric dentistry, where all these cartoons are there, positive reinforcement, 3D photos they have kept, so that it is a pleasing environment they have kept for the child, for the pedo patient, so that they develop so that we can instill a positive attitude towards the dentistry. But I said, see, in our curriculum itself, so many things which taught to us other than the use of instruments. Say, suppose this mouth mirror, the use of mouth mirror, it is like to retract the cheek and to see the oral cavity properly. But we as dentists or in dental schools, it's been taught to us the other end of the mouth mirror, tenderon percussion. You have seen a caries tooth, you know that it is slightly tenderon percussion, and the child itself is showing the doctor, I have caries onto this tooth. But still, we are not satisfied by the way the child or the parent has given the history, and we are not satisfied by the way there is a dental caries. But we need to you do the tenderon percussion. So immediately the child again going to a non-cooperative way. Again, see the probe. Probe is just to remove any debris or anything is there, so that you can just check the depth of the cavity. But we will be like, we'll just push it into the cavity, so that we wanted the child to something like just child should develop some pain. So these are the things which we commonly show it to the pedo patients or to the other patients. Automatically, they start developing anxiety about the dentistry. See, this is... Sorry. So my video is sorry not playing. So see, behavior management, we have two types of behavior management, like is pharmacological behavior management and non-pharmacological behavior management. So it's all about to remove the anxiety or the fear of the patient, then to develop a positive attitude, and at the same time we should be able to perform a quality treatment. So whatever the treatment what we do for the pediatric patient, the first thing, because even if the child is not cooperating, then the first thing the parent is going to ask to you is like, doctor, you have done the restoration, now how long it is going to stay? Because you know that the child was not cooperative and you could not achieve a proper isolation properly, or you cannot do a proper cavity, you cannot do a proper isolation. You know that your filling is not going to stay. But the immediate question will be from the parents is like, doctor, do you think how long this restoration is going to last? So as dentists, why we need to have a behavior management is to have an effective and efficient treatment we need to deliver to the patient. So when you do a restoration, you know that the restoration should stay in the mouth for a long period of time, or when you remove the tooth, you should not keep any root remnant inside back. You should be able to remove it completely. Or when you do a pulp therapy, or when you do a restoration, or when you do a crown, it has to be done properly so that it stays inside the mouth for some time. Okay. At the same time, you should have a safety of your treatment, for your safety of your patient as well as your own safety. Because when you do a cavity preparation, it should not, your burr, very speed rotating burr should not touch the tongues, or it should not create any bleeding onto the gingiva, or accidentally you should not expose the pulp. So it's like safety of your patient. At the same time, see, a child bites your hand and there is a trauma, or when you give a local anesthesia, it is like if by accidentally you prick on your hand. So that's all your safety, because your patient safety should be there, as well as the safety of your own health also should be there when we think about the pharmacological behavior management. So when you think that, let me start with my lecture today. Is like, see, pediatric dentistry, I can say it's a sandwich. You have small, I can put so many things into small pieces, like so that it is easy for you people to understand what exactly is all about pediatric dentistry. And when you work on a pediatric patient, how you can divide your treatment, so that it is easy for you to perform your treatment. So see, when I say it's pediatric dental sandwich, it's your treatment. You have lots and lots of treatment options. See, you have your growth and development will be there, your say habit breaking appliances. So many habits, you need to find out the habits of the children and to correct the habits. Then you have growth of the mandible, or growth of the maxilla, or growth of the bone will be you should need to consider. So myofunctional appliances or orthopedic appliances are there. Then you have habit correction appliances are there. Your space maintainers are there. You have interceptive orthodontics. It's like you have space regainers, your myofunctional appliances. Then you have serial extractions. So many treatment options. Then you have surgical parts. You have extractions. So you have balanced extractions. You have planned extractions. You have therapeutic extractions. So extractions of different types you have in pediatric dentistry. Then you need to do behavior management of different sort. Okay, so it's like so we need to put so many treatment options in pediatric dentistry. So that is one thing, that is a sandwich technique. Again, you have when you come to patients, you need to work very fast. So work quickly, safely, and effectively and efficiently for the treatment. So I usually divide my treatment into 3 parts: pre-treatment, during treatment, and post-treatment. So in the beginning part is called the pre-treatment. In pre-treatment, you need to just sit and talk to the child, because any of your behavior management technique just starts with communication. You need to communicate with your pedo patient. So you need to have little humor sense, little joking, playing with the children, answer to the patient, answer to the parent at the same time. So many things you need to do. At the same time, you need to work very quickly, and it should not pain for your pediatric patient. See, when you work on the pediatric patient, you should finish off your treatment very fast, and it should not hurt your patient. And same time, your parent, with the patient's parent, will be asking so many questions. You need to answer to them their queries. You need to, at the same time, you need to communicate with your staff. Your staff will be asking, doctor, see, the other patient have called you, what time should I give appointment? At the same, doctor, are you going to go for a GIC restoration, or are you going for some other restoration, or a temporary restoration? So you need to answer the queries to your staff, the parents. Same time, the patient also, doctor, what you are going to do at me? Is it going to hurt? So it's like you need to answer so many queries to different people at the same time. Then you need to perform your treatment very quickly, and it should not be painful to the patient. So this is all about pediatric dentistry. It's all sandwich. It's in between sandwiched. So yeah. So your treatment should be like effective and efficient. Dental treatment should be there. When you do a restoration, your restoration should be properly stayed inside the mouth for some time at least. Then if at all you are doing a pulp therapy, or if you are doing a restoration, it should not pain for the child. So post-operative pain should not be there. There should not be any swellings, because you cannot say that, see, the child was not sitting quietly, so I could not do I cannot remove the pulp properly and irrigate the pulp properly. So that is why there is a swelling. So the parent have come to remove the pain and swelling, and you cannot say he or she was not sitting properly, I cannot do the treatment properly. Then safety factors. I said, when you give a local anesthesia, see, so much of complication is there in a pediatric patient, because a complication of local anesthesia itself is there. Then the local complications like fracture of or the needle breakage will be there. There can be accidental swallowing of the crown can be there. Accidental swallowing of your files will be there. So safety factors also you should consider when you treat your pediatric patient. At the same time, you should instill a positive attitude, because next time the child should say that, yeah, I am going for a dental treatment. So my doctor uncle or doctor auntie, they, excuse me, they are so good that they are not going to hurt me, and they are very friendly to me. So they should come back to you after the treatment as a friend, so that you are instilling a positive attitude, not only towards the dental treatment, but overall general health of the patient. Okay. And never think that all the pedo patients are uncooperative, because see, some patient who comes to you at the age of 2 years or 1 year, definitely their behavior have not developed properly. So you cannot communicate with the child. So that doesn't mean that the child is not sitting for your treatment, doesn't mean that that patient is uncooperative patient, because the same patient maybe at the age of, because he might have developed little more or grown little more by the age of 4 or 5 years, definitely he is going to become a cooperative child. But the child has not developed, the age has not developed for that child, so that he is not cooperating. So it's just matter of age. Some children, because they have other physical disabilities like Parkinson's disease or hyperactivity syndromes, or autistic child, so many other clinical systemic factors will be there which prevents them from not cooperating. So that doesn't mean that all your pediatric patients are uncooperative. It's just matter of age or their physical or mental health status which prevents them from not cooperating. But 90% of your pediatric patients are cooperative, or the way, if at all you can communicate with your child properly, definitely they are going to be a cooperative child. See, this is one of my patient. She was very uncooperative, but I could manage her with the help of nitrous oxide, and she was so happy, because first of all, she was not happy with the smile she had. So she wanted a good smile, but at the same time, she had a previous traumatic or bad experience with other dentists, which prevented her from not going to the dentist. But see, after having a positive 2-3 sittings with this child, she was very friendly to me, and I could create a good smile for the child. And believe or not, it's like she's like, every time she comes to me, she comes with a gift, because she just says that, Doctor, uncle, you have helped me to smile. So that's what the children are all about. So even they like to have a good smile, but it's our duty to instill a positive attitude, same time painless treatment for them. So she's the same one. Okay. Again, when the patient or parent comes to you, you should be able to make sure that you properly educate the patient. Okay. So what is the use of first dental visit? See, most of the parents, they bring the child when there is a pain, or when there is a severe pain or different caries is there. They bring the child for a dental visit, and immediately what they want, or there is a mobility of the teeth, immediately what they want is like, doctor, you do the extraction, because they have come with their own diagnosis, and they have come with their own treatment plan. And it is you as just a labor worker, you need to just do the treatment plan. They act like doctors, and they just tell you, doctor, do this treatment. You do an extraction. I don't want to hear anything else. I want it today, now itself. Or you do this filling now, doctor. Why you are not doing the filling today? So the importance of first dental visit, you need to educate the parents properly, because that is where your basic pediatric behavior management starts. Okay. Now, some parents will be there, doctor, we always say, oh, this has happened because of a feeding problem. This early childhood caries, because of the feeding problem has happened. But then they will say, doctor, how should I feed the child? And as a doctor, you should know, make sure that the proper feeding habit has to be told to the parents, so that they can develop that habit and make sure they feed the child properly to prevent your nursing bottle caries or early childhood caries. Then sometimes they will be asking how to clean the gum pads. A small child less than age of 6 months, how to clean the gum pads. Some of us say that clean it with some cloth. Okay, some people say that finger brushes. Okay, so when to start brushing for the child, when to introduce toothbrush for the child. Sometimes they'll ask, doctor, I have started using toothpaste, but as dentist we should tell them what age they are supposed to start the toothpaste for them, because most of the toothpaste in that it is written that children below the age of 6 years it should not be used. Even for the pediatric toothpaste, you'll say that Kidodent or a Colgate Kid, it's all written here and there that less than the age of 6 years, only under the parental supervision this should be used. So the child themselves or alone cannot take toothpaste. So what age a toothpaste should be introduced for the child, what age a toothbrush to be introduced for the child, then how the gum pads has to be cleaned for the child, how to do the brushing for a child patient, or how to hand over the duty. Because see, early age, it is the parent need to clean the teeth and gum pads. Then slowly you are giving the slow half of the duty to the child by brushing in the morning time. The child should do the brushing in the morning time. Then evening time, it's the parent need to do the brushing. So by the age of 8 years, it's complete transfer of duty should be there. So morning and evening, the child is going to start developing brushing by themselves. So when to hand over the duty for the child patient, then it's like see, what is a good toothpaste? Because most of the people comes to me and ask, doctor, which toothpaste is good for me? Which toothpaste is good for my child? I have sensitivity. What toothpaste has to be used? See, I have these white lesions on my teeth. Which is the good toothpaste to be used for, so that I prevent the caries from beginning? So there are 3 different types of toothpaste. You have toothpaste for normal use, that is your normal ideal toothpaste used. Then you have medicated toothpaste for sensitivity and other things, gum diseases and gum disease, and for sensitivity you have medicated toothpaste you have. Then you have toothpaste for remineralization. So that is for preventing dental caries. You have tooth creams. Okay, so you should know what are the 3 different types of toothpaste for your patients. Then it's like how to do snacking. What is good snacking? What is bad snacking? And what is the time at which the snacking can be given? Or diet modifications. We have learned a lot in our dental school about diet modifications, but exactly what diet modification, how it has to be formed, we should be knowing, so that we can tell our patients and educate the children and the parents, so to have a good oral health. So educating the young married people just before pregnancy or during pregnancy time is also an important role of the dentist. So dentist should be all about a family centered. So just before, so pediatric dentistry just starts before birth, we can say. It's when the child is during the pregnant time, when the mother is in pregnancy time, your pediatric treatment actually starts. So how to take care of the mouth of the mother during the pregnancy time, when the child is born, how to take care of the gum pads, when the tooth erupts into the oral cavity, 1 or 2 teeth erupts into the oral cavity, how to take care of it, when all the primary teeth erupt into the oral cavity, how are you supposed to do the oral cleaning, how to hand over the duty of the parents, then which toothpaste is good for your pediatric patient, which toothpaste is good for the parents, which toothpaste for your sensitivity or gum diseases, which toothpaste can be used for the remineralization of the teeth, so that you have minimally invasive dentistry. So that is all about dental home. So you should be able to, as a doctor, you should be able to answer to the parents. Okay, not only educating the parents, but also your physicians, nearby physicians, because they are the one who says, oh, this is due to calcium deficiency, nothing to do, don't worry, this teeth anyway is going to go off. Okay, so you should tell them about what is early childhood caries, why there is teeth decay, what is traumatic ulcers, abscess and sinus. Because I have seen in one of my places which I go for consultation in one of the hospital, the pediatricians have sent the child for so many investigation like CT scan, MRI, so many things for just a small swelling on the face. Finally, they have referred the patient to the pediatricians. They referred it to the different scanning centers. They have sent it to the END, and finally they could not find out anything. Then they said, okay, anyway, we have a pediatric dentist coming to the hospital. Let's have an opinion with the pediatric dentist also. Finally, it was just a tooth abscess for which the parents had to spend thousands and thousands. And finally, when it came to know that it is just because of a dental caries, it has happened. And I said, pulpectomy has to be done and a crown, if you give it, this will be okay. And the parents agreed to it. And when I said the cost of the treatment, oh, doctor, for small teeth with small caries and this infection, why you are charging so much? So, see, that is the mentality of the parents as well as the doctors in our community. See, they are ready to spend thousands and thousands for investigation, but they have less idea about the oral diseases, odontogenic infections, sinus abscess are there, and how to take care of the oral cavity, importance of primary teeth. See, instead of we educating the parents, I think it is very important for all the dentists to educate the physicians, the pediatricians in your nearby area, what is the importance of primary teeth as dentist. Okay, and nowadays we have some immunoglobulin tablets are there. So that is no decay tablets, which again can prevent the dental caries. So it's all education. It's all about education. Then I said your appointments like pre-treatment, during treatment, and post-treatment. It's pre-treatment. You will be just communicating with your pediatric patient. Just talk me. It's like meet and greet for kids. You just talk to the patients. You greet them. You have fun-filled, what do you say, talk with them, with the family members, with the other people who have come with the kid. Sit and chat with the patients. It may not be towards the dental treatment, but other things you can sit and chat. Give a lot of prices like stickers, labels or erasers, anything, or brushes to your pediatric patients. Joke with them, smile, take a tour in the dental clinic, praise the child about their dresses. So these are the small things which we can do during the pre-appointment time, where you are not talking about anything related to dentistry. Just 2 seconds joke. Sorry, I don't have much time. Okay. Second, see, you have during the pre-visit, you have functional inquiry. That is about the medical treatment which they have undergone, or the behavior of the child during with the pediatricians, how the child is reacting during the medical procedures, or the anxiety of the child, the parental expectations. These are the pre-visit appointment. You need to talk to the parent and to the child, and it is timing of the treatment. See, when you start the timing when to start a treatment for the patient. So it's like early morning time and short appointments. That is why we say during treatment, it is very short timings. So your treatment should be finished very fast, quickly, and it should be less painful, or pain-free treatment should be there for the treatment. So, and slowly you start introducing painful things like, see, first you start with case history, or take an X-ray. Then when you see the patient, you can go for just an oral prophylaxis. Simple restorations can be done. That is why phases of treatment, simple restorations can be done. Later, if at all you want management of deep caries lesions has to be done, then you can think about pulp therapies, or pulp therapy you can go ahead. Then extraction of the teeth, then space maintenance. So slowly you are introducing painful things, so that by the time the child is going to become very cooperative with you. Okay, then you have stimulating or distracting object, because you have toys inside your clinic, or you have more fun-filled things. So that's all. They're going to distract the child or stimulate them so that they easily come to the dental treatment. Okay, and when you treat with very young child, say 2 years, 3 years, you should be flexible to the patient, because the child sometimes he just comes and plays with you. So need not that each time you need to carry a mouth mirror and probe to see. You look at these pictures. So sometimes you don't require a mouth mirror and probe to see the oral cavity. By just looking into the mouth, you can diagnose your things. Okay. Sometimes here this patient, he doesn't want to sit straight. He wants to sit in the upside direction. So wherever the patient, however the patient is sitting, it is your duty to look into the patient's mouth and do an examination. So you should be flexible enough to carry out your treatment. It's like a patient who came, he doesn't want to drill anything. So I just done a restoration and placed the separator in between, and seen this. I have done two crowns for the patient. This is called Hall's technique. So it is like deferred treatment where you are not actually preparing the cavity. You should not insist that, yeah, this is a cavity where I need to do a proper cavity preparation and then do the restoration. No, sometimes you need to defer the treatment and go ahead with the treatment, like stainless steel crown in this case, which is a good choice for this patient, because this patient is very uncooperative. And sometimes we use the words like, bad boy, I'm going to drill you with this. If you're a good boy, still I'm going to drill you. So there is no point in, there is no difference. For the child, if I am good, if I am bad, whatever it is, the doctor is going to drill at me. If you don't sit properly, if you don't sit properly, see, I'm going to kick your teeth out. So these are the things which you usually should not use in your dental treatment. Okay. So during the treatment, it should be more of fun. Discuss about the stickers or prices. Sure, treatment should be short and sweet, and it should be fun filled. All gifts you should be giving. So during the treatment, manage their expectations. See, they expect a painless treatment. Yes, you should be able to deliver a painless treatment and the trust of the patient. If you say that, I'll count till 5, if you keep your mouth open, I'm going to stop after 5. So you should stop the treatment after 5. So you should not think that if the child is sitting quietly, yeah, I can do little more preparations. No, you should not do. When you that is where you earn the trust of your pediatric patients. Sometimes you need to do tell show do, sometimes modeling technique. Okay, sometimes creative wordings. The wording should be so creative that it should not pain for the patient. Okay, so these are the things. You should be little flexible. You should not hurt the child. You should give more of fun and rewards. Okay. Again, you have different choices. Like, see, you have virtual reality. You have many sensory adapted dental environments, which creates more interesting for the child. Okay. You should also know which treatment you should see. If you are not a pediatric dentist, which patient you should take into treatment, because see, the 1 and 2, yes, definitely you can handle, but this third patient, you think that, okay, he is going to sit, but definitely he is going to be a more aggressive patient. So 3, 4, 5, either you should refer to a periodontist, or if you have a periodontist, you can do it in your own clinic. But some patients who are highly uncooperative, you might have to refer to a higher center where you have your conscious sedation or IB sedation. So you should know when to refer a patient, which patient you can take it by yourself, which patient requires a consultation of pediatric dentist, which patient requires an expert consultation with a higher center. Okay, so in this, these are the basic things which usually come across in pediatric dentistry: communication, positive, pre-visit imaginary, direct observation. So these are the common things which we have learned in our day-to-day practice. And since we don't have much time, I cannot go in depth about this treatment, but definitely I think we can later. I can do with your questions. Okay. Yeah. Thank you. Thank you so much. I think I am on time. Dr. Sanuf.
Thank you so much, sir. Okay, so
I know I was very, very, very fast, because it's a last topic which we usually conduct in SAFE for 2 days. It's a 2-day program which we have concised to just 1 hour or less than 1 hour. So I had to just rush through and I have just went through the top part of it. But definitely we can have a big session. Yes. Yes, Dr. Sanuf.
Yes, sir. I think we do have a question, sir. Yes, if
Yes.
anybody is interested to know more, we do have a question answer session. Please do post your questions in the comment section. Okay, I think we have our first question, sir. What is the indication of GC tooth mousse and how to use?
See, GC tooth mousse, that's what I say. It is a remineralizing toothpaste. It is not a tooth paste, it's a cream. It's like when you see white lesions on the teeth, it's early loss of calcium. You are just supplementing it back. So this GC tooth mousse, it helps in remineralization of the teeth, and it is what do you say, helps in remineralization and minimal invasive dentistry. So you need to apply it to the child when the child is sleeping during the night time. It's not that you start brushing with your tooth mousse. Actually, it is a tooth cream, which you need to apply throughout the night. It should be there inside the mouth throughout the night so that it can help in remineralization. So when the child has slept, actually you need to separate the lips apart, and you need to apply it onto the tooth so that it helps in remineralization. Yeah.
Okay, sir. So the next question is, what is the name of the medication which prevents cavities, which was mentioned?
See, that is again the tooth mousse. The tooth mousse is the one. Tooth mousse means any toothpaste which contains ACP CCP mechanism, which has got phosphate, fluoride, and calcium. Which see, how you should know actually how the tooth decay occurs. Tooth decay occurs by demineralization. That is when the pH inside the saliva increases, that is towards the acidic pH, there will be calcium from the teeth coming to the saliva. So from the higher concentration, the calcium and phosphate comes into the saliva, and there will be decalcification. So what this tooth mousse does is, when you apply tooth mousse onto the teeth, there will be more calcium and phosphate inside the saliva, which prevents the decalcification to occur from the teeth. So the calcium and phosphate from the saliva actually goes into the tooth and remineralize the teeth. Yeah.
Okay. Sir.
So that's where it functions. It helps to remineralize.
Okay, sir. So could you give us a little bit insight of which is water soluble and fat soluble medications?
See, there are so many medications onto that. See, that's what there's a separate topic into antibiotics and analgesics in pediatric dentistry, which is again is a vast topic, because if I just start, it will be definitely will not finish it in on time. But see, Sarah, there are certain medications like amoxicillin with clavanic acid. Actually, you should not give it for a pediatric patient less than the age of 4 years. Okay, so most of us, I have seen most of the dentists or pediatric dentists or even the pediatricians, they prescribe antibiotic which contains amoxicillin with clavanic acid. Okay, so these medications, actually you should not use it for pediatric patients less than the age of 5 years, which is actually going to harm their kidney and liver. So this medicine definitely you should not apply. And there are medications which are fat soluble and water soluble, because again you need to take your old pharmacology textbook and refer which has the fat soluble, which are water soluble. So again, I think I can put it in this group. If at all, Dr. Sanouf, if we can make a group, I can definitely put water soluble and fat soluble medications later.
Sure, sir.
Yeah.
Okay. So the next question is how to manage patient with congenital cardiac anomaly.
See, how to manage pediatric patient who has got congenital heart disease, right?
I think the considerations.
You need a pre-medications or not, right? It's again depends upon what type of disease the child is having. Because if the child is having just a dental caries, I don't think so you require a pre-medications or anything. But if the child is having definitely a caries which is involving pulp, you need to have a pre-medication or you need to go for an extraction, a patient having cardiac disease, definitely you need to go for a pre-medications. Other patients who doesn't have infections doesn't require a pre-medications. Again, pre-medications, whether you have to go for just with penicillin, or who have got allergy to penicillin, it all depends upon that.
Okay, sir. Any certain age to start a fluoride application?
Definitely yes. Because see, fluoride, it should not be given to very young patients. Okay, fluoride, you can do it professionally in your dental clinic under your guidance, or patients who have developed proper communication with their parents. Because when we say he should properly gargle and spit it out, then you can start with your fluoride application. Or else, for young patients inside the dental operatory, it is the sole responsible, because you are applying with a professional way. So it is under your supervision, you are starting it. And the fluoride applications, like see, fluoride varnishes, you have different type of fluoride varnishes that can be started using at the age of 3 years, 6 years, 9 years, 11 years, and 13 years. Under in your dental practice, that is professional application. And at the same time, you have home application also. For home application, it should be clearly told how it has to be used, and depending upon the age of the patient, you should start using it.
Okay,
Yes.
sir. So the next question is, can we use GC toothpaste in permanent dentition as well?
Definitely you can, because in permanent dentition, you have GC toothmousse plus. Because see, you have GC toothmousse is just without fluoride. GC toothmousse plus means it's with fluoride. So with fluoride is more helpful in adult patients. So even for adult patients, you can use it by special tray technique, or like I said, after the patient has slept, you should apply. It's not that just they apply and then sleep, because by the time the patient sleep, he would have already swallowed the half a full of the toothmousse inside. So doesn't have any action. So the action should be locally. Toothmousse action is locally. So you should actually have separate special trays, can be prefabricated, and this toothpaste can be placed inside the special tray and kept on the teeth. Or else you can you tell the partner that after he or she has slept, they can just place the paste inside the mouth. Yeah, that's where it has to be applied for the adult patient also.
Okay, sir. So what is the exact age to start toothbrushing? What is the exact age to advise the parent to start brushing?
When the child has started to spit the gargle and spit the water properly, and you have taught the child how to gargle and spit the toothpaste properly out, then you can start using the toothbrushing technique for the child.
Okay, sir.
Again, a lot of things I need to speak onto it, but short time.
So it's actually my personal question, sir. So
Yeah.
what is your take on non-fluoridated toothpaste?
See, when actually, for any of the pediatric patients, see, for that, first you should know what are the ideal properties of the toothpaste you should prescribe for your patient. Okay, so it's all like you have a white, creamy, non-foaming, fluoridated or non-fluoridated toothpaste is the ideal choice to be prescribed for the patient. It should be white in color. It should not have different colors. It should be creamy. It should not be powdered form. It should not be in gel form. It should not be added. Your salt is added, charcoal is added. That should not be added. It should be just a creamy in consistency. It should not be foaming, because foaming means it has got sodium lauryl sulfate, which is again going to irritate the intestine of your pediatric or the adult patient, which is again harmful for the patient. So it's like non-foaming toothpaste. And now depending upon what other supplementary fluorides you are taking or not, depending upon that, you can incorporate fluoride into your toothpaste or not. Okay, so this is the ideal characteristics of the toothpaste which you use. So you need to find out a toothpaste which has got this ideal characteristics.
Okay, sir.
Yes, Anup?
So, okay,
I
sir.
know you
Thank
have
you.
not got exactly what I wanted to convey it. Yeah.
No, nothing like that, sir, actually. But definitely it will be helpful for others as well, as if they had attend the program, the 2 days program. So
Yeah,
definitely
definitely. Because see, it's
uh,
the tooth, how to select a toothpaste. I said how to clean the gum pad of the child, how to start brushing for your child, then when to introduce a toothpaste for your child, which is a good toothpaste for your child, and how to hand over the duty for toothbrushing. It's a big, and then like so many of you have put which is antibiotic good for a child, which is a antibiotic water soluble, which antibiotic is fat soluble. It's a vast topic which I need to speak on maybe like 2 hours or 3 hours. So I think the program on 4th and 5th of March will be more helpful for me to put across the things.
mhm. Okay, sir. I think we had come to the end of the discussion, sir, because we do have some questions actually, but it is all out of topic. Definitely, we'll try to answer those questions
See,
in
these
any.
questions I have seen. See, what which is a good obturating material,
Hmm.
then antibiotics. So many questions I have seen that, and it's all see the time. Mainly the time. If you can put it across to me, I think Dr. Sanuf, if you can put across these questions, I can definitely answer all this.
Definitely, sir. Definitely, sir. We do have a social media platform. So if
Yeah.
anybody is interested to know more about the program as well, and I hope so if to help you manage and treat pedo patients in daily practice, we do have this comprehensive pedodontics program, which is a 2 days program. So this program gives deep insights of pedodontics, which includes diagnosis, patent fissure sealants, fluoride varnish, pulpectomy, stainless steel crown, medication, epixification, and just so on. So we will have an hands-on exercise and everybody will witness a live case demonstration as well. So if anyone is interested, please do contact in the mentioned numbers and for the registration. Okay, and we'll try to answer those questions in the social media platform. Okay,
And
sir.
I'm so
So
sorry that even my family is waiting out there, booked for a movie, and all of them they are waiting in the car.
Okay, sir. Thank you so much, sir, for your valuable time.
Yeah.
It was very informative, and definitely many of us will depart this session with many takeaway points and implement technique as per discussed.
Yeah.
So thank you so much, sir.
So thank you all for patiently listening to this very fast lecture, very vast topic also. So thank you all.
Thank you so much, sir.